Hey everybody, welcome to Chapter 3 in NURS155, Basic Medical Terminology. So today, Chapter 3, we're going to talk about the skeletal system, something that I really like. It's a body system that I like. I started my career in healthcare as an x-ray technician. So the skeletal system, obviously, is a system that I needed to know a lot about at the time, and I think it's important that you do too. So, what are we going to learn in this one? We're going to learn a little bit of the anatomy of the skeletal system. We're going to be able to describe some of the physical exam characteristics of working with patients and their skeletal systems. Some of the tests that we use to diagnose disorders, and then some of the disorders and the treatments for the skeletal system. Okay, so what does the skeletal system do for us? Well, it protects our internal organs, right? Protects the internal tissue and organs, provides stability, in particular our spinal column and our pelvis, really provides a stable environment, provides surfaces for muscle and ligament attachment so that we can move freely, okay? Does produce red blood cells and stores mineral salts like calcium, okay? So, classifying the skeleton is divided into two parts. The axial skeleton, which is your spinal column and your vertical axis, okay? And that contains 80 bones. And then your appendicular skeleton, which has 126 bones, and that is for your upper and lower extremities. So in total, we have 206 bones. However, we do have some accessory bones called sesamoids. And the patella, your kneecap, is actually a sesamoid bone. It's not included in the 206. Some people may have these sesamoids in their thumb or in their big toe, their great toe. Some people may have one, some people have three. They're just a little accessory bones, and oftentimes they help to aid in movement. Okay, so the axis, that goes from the skull all the way down our vertebral column and through the rib cage. Okay, so it talks about the skull comprising 8 cranial bones, 14 facial bones, and 6 inner ear bones. Okay, and then when we get to the vertebral column, this is one where you'll have many tests where they may ask you about your spinal column. Okay, so the cervical spine, which is from in the neck, 7 bones in there, seven cervical vertebrae, okay? Oftentimes the first 2 on the top are called the atlas and the axis, and that allows our head to move back and forth, side to side, up and down, okay? And then we have our thoracic cavity, and the thoracic cavity has 12 vertebrae, and then our lumbar spine, the low back, has 5 vertebrae, and then the sacrum and the coccyx are fused bones together, okay? Let's see, the rib cage, I like that one, is part of the thoracic cavity, contains the sternum and the ribs, 7 true ribs, which means that they are connected by cartilage to the sternum, and 5 false ribs, which are not connected with cartilage, okay? All right, let's see here, the appendicular skeleton, that's the one that has the 126 bones, okay? The clavicle, scapula, humerus, ulna, radius, all the carpals, the metacarpals. In the lower extremities, of course, we have the femur and the tibia and fibula, metatarsals and tarsals and phalanges and the calcaneus. A lot of different bones there. I highly encourage you to understand where these bones are and what they're called. Okay, so take a look in your chapter or take a look at the skeleton and try to memorize as many of those bones as you can. Okay, bones are classified by shape and by the type of bone that it is. Okay, so long bones, main bones of the limbs. So long bones are the femur, the humerus, the ulna and radius, tibia, fibula. Those are long bones. Okay, short bones in the wrist and ankles, so your tarsals and your carpals. Flat bones, the sternum, okay, the sternum, The scapula, the cranium, those are flat bones. And then irregular bones, because they're odd shaped, in particular, your hips and your vertebrae in your spinal column. Okay. And then the type of material, compact versus cancellous. So compact, smooth, compact bone, and then cancellous bone is very spongy and porous. Okay. All right. So there's a good 2 views of the long bone. So that is a femur right there. You can see where that cancellous bone, that spongy bone, is near the femoral head, okay, at the top. And then you can see how that turns into or becomes compact bones the further down the shaft of the femur you go. Okay. Bone growth, so bone formation or ossification. In adults, okay, it says resorption balance each other so that bones remain constant in size. So as a child, ossification occurs at a faster rate than resorption, and that allows for growth. Okay, and then bone growth is controlled by the pituitary hormones. All right, so let's see. Bones grow longer at the epiphysis. So have you ever heard of the epiphyseal plates, where when you're young, in particular, the heads of long bones like the humerus, if you took an x-ray of a child, it kind of looks like that the shoulder, the top of the shoulder, is disconnected from the long bone of the humerus. That's the epiphyseal plate, and as we age, that starts to fuse together. Okay, so that's where bones grow longer in that portion. All right. So osteoblasts and osteoclasts. Osteoblasts are cells that add new tissue, and osteoclasts are cells that destroy bony tissue to prevent bones from becoming too thick. Okay. Cartilage, connective tissue. Okay, so we have, I said earlier, we have cartilage in our rib cage. In between each rib is cartilage. It's connective tissue. It connects those ribs together. We have other places where there's cartilage, in our knees in particular. The meniscus is cartilage, kind of acts as a shock absorber in your knees. Okay. So joints can be classified 2 ways: range of movement, by the range of movement that they allow, and by their structure. Okay. So here's the range of movement classifications. Synarthrosis are immovable joints. Okay. Amphiarthrosis, slightly movable, and diarthrosis are freely movable joints. Okay. Classification by structure: fibrous, okay, so very little movement; cartilaginous, slight movement; and then synovial. Synovial joints are freely movable because they have synovial fluid that allows for free movement. Okay. All right, and then it tells you which ones are the synovial joints, like the wrists and the ankles, and allows for free movement. Okay. Let's see. On the physical exam part, these are some terms that you might see when we're discussing the physical properties of a patient. Okay, so on physical exam, angular, circular, crepitus is cracking sound. If you have any cracking in your knees or in your elbows, if you have old knees like I do, they crack fairly frequently. That's called crepitus. Okay, posture, range of motion is a physical term, and then symmetry. Okay, movement and range of motion. These are terms that are very specific to movements. Abduction and adduction. Easiest way for me to remember these two is abduction. If you think of the word to abduct. Abduct means to take away. So when we talk about abduction, we talk about moving away from the midline of the body. Okay? Moving away. That's abducting. Moving toward the center of the body is adduction. So abduct, take away; add, ADD, adduction, bring it to the center line of the body; circumduction, moving in a circular manner; okay, extension and flexion; extension, flexion, extension, flexion. Okay, Pronation, turning downward to pronate. Supination is to turn upward. So pronate. So if you think of two words we use when we place patients in certain positions, to pronate or to be prone or to be supine. So to be prone means to be on your stomach. Okay? So pronation, turning downward. Supine means laying on your back. Supine or spine, laying on your back. Okay? And that means to turn upward, facing upward. Okay? And then there's internal and external rotation. All right? Common complaints, diseases, disorders. Okay? Arthralgia, very generic term. Okay? Arthralgia is joint pain. Okay? Arthrodema, joint swelling. Okay? So arthro or arthur is referring to joint. Okay? So that's a word part. It is a root. Okay? Algia in arthralgia. Algia is pain. So that's a suffix. So if you go back to chapter 1, right? Identify the root. Arthur, joint. Identify a prefix or a suffix. We have a suffix in this case. Algia is pain. So anytime you see algia at the end of anything, that means pain is occurring for whatever the root is before it. Okay? Same thing with arthrodema. Edema is swelling. So if you see edema at the end of anything, whatever came before it is swelling. Okay? Bursitis, inflammation of the bursa. Very common to see that in elbows. Chondritis. Chondro is cartilage. So chondritis, itis, inflammation. Again, itis as a suffix is inflammation of whatever came before it. So chondritis is inflammation of the cartilage. Okay? Chondromalacia. Malacia is softening. So chondromalacia is softening of cartilage. Okay? So some good terms there. Terms that you'll hear fairly frequently. Kyphosis, lordosis, scoliosis. These are terms referring to the curvature of the spine. So kyphosis, it says it's a convex curvature of the thoracic spine. Convex, what's the best way to say it? It's humpback. Okay, so kyphosis, if a patient was kyphotic, they would be hunchback. You see that oftentimes with older people, with geriatric patients, right? The hunchback, that's kyphosis. Lordosis is a forward curvature of the lumbar spine, which causes people to basically kind of move backwards. That's called swayback. Okay, so kyphosis is hunchback. Lordosis is swayback. Scoliosis is an S-word, S-shaped curvature of the spine, side to side. Scoliosis. Okay. Lumbago is kind of an old term. I don't think we use very much anymore, but pain in the lumbar spine. Okay. And we get into some of the tests. And I apologize, I'm moving fairly fast through this, but we had about 24 slides to cover. And I'd like to try to keep these videos down to about 20 minutes. So we're going to run through it. Make sure you read your chapter thoroughly. Okay. And then when you take your exam, make sure that you understand the chapter thoroughly as well. So certain blood tests that we use for skeletal system disorders, an ALP, alkaline phosphatase, okay, helps to diagnose certain bone disorders. Erythrocyte sedimentation rate, or an ESR. Sometimes that's also called a SED rate. Sometimes it's also called a Westergren. It's got a couple of different names, but an ESR looks for inflammation. So if a SED rate is elevated, that tells us that there's some inflammation that's happening. Okay, rheumatoid factors, when we're looking for arthritis, rheumatoid arthritis, we'll do a rheumatoid factor. Oftentimes we do that in conjunction with the ESR as part of a arthritis panel. Okay, of course calcium, in particular for the females. Calcium loss, bone deficiency. Females are definitely seem to be more prone to calcium deficiencies than men. Okay, different aspiration tests like bone marrow aspiration. Okay, taking a little bit of bone marrow to check that for disorders or diseases. Okay, different radiologic tests, right? Simple X-rays. X-rays simply show bone and some soft tissue. So those are pretty not very in-depth, right? Routine X-rays. When we want to get more in-depth and take a look at structures a little bit better, we oftentimes use a CT scan or computed tomography. We can get into arthrography, which is injecting dye to to identify or to visualize joint spaces better. Okay, bone density tests. We do a lot of those. Looking for mineral disturbances in the bone. Bone scans, we do a lot of those, and myelography. Again, that's another one where we inject some type of a dye or a contrast media to examine the spinal cord. Okay, arthroscopy. These are procedures. So arthroscopy, if you had arthroscopic surgery, this is where we insert a little camera into the joint space so that we can view that joint space, so that a surgeon can determine what type of damage is done and what type of procedure needs to be performed. Okay, bone marrow biopsies, very common for diagnosing things like bone cancer and other types of cancers, bone marrow cancer. Okay, MRIs, definitely we see a lot of those. Can really visualize soft tissues better than a regular X-ray can, so we can look at things like tendon and ligament. Okay, different joint injuries, different types of fractures. Open and closed are probably the two that you'll hear fairly frequently. Okay, so a closed fracture means that the bone didn't break through the skin. An open fracture means that the bone broke and it also protruded through the skin. Okay, Colles fractures are at the radius at the lower end of the wrist. Okay, so the radial side, which would be on the thumb side. Comminuted means broken into many different pieces. Spiral fractures are typically caused by twisting motions. And then green stick fractures are common in younger children because their bones are still fairly soft and pliable and movable. So a green stick fracture, that's a childhood fracture. Okay. Other common injuries, right? Dislocation, the moving, displacement of bone from a joint space from its normal position. Herniated discs, rupture in the disc area in the cartilage, because we have cartilage in our spine, and that cartilage acts as a shock absorber in between our vertebrae. Okay, bunions, inflammation at the first metatarsal phalangeal joint, which is on the great toe. We see that fairly frequently. In particular, unfortunately, I see it a lot in females. Okay, and then calluses, bone formations that can occur at the site of a bone fracture. Okay, different types of diseases. Very common ankylosing spondylitis. It's a slow and progressive inflammation of the spine. We see that one fairly frequently. Osteoarthritis or degenerative arthritis that happens over time. Osteomalacia, softening of the bones, can be caused by calcium deficiencies. Okay, osteoporosis, where bone mass is reduced. Okay, rheumatoid arthritis, bone tumors. Okay, so these are all very serious disorders. Okay, some non-invasive treatments, things like splints, splints and casts. Right, we're not doing surgical. We're not entering the body to fix anything. These are non-invasive, very common in doctors' offices. In my career as an X-ray tech, I've become very good at making splints and casts for patients. Fairly common. Closed reduction and traction for certain things. Typically traction I see in the hospital setting. Invasive treatments, now we get into things like surgeries, right? Open reduction, arthrectomy, ectomy, typically surgical removal, right? This says excision of a joint, so that's basically the removal of the joint or possible replacement of a joint. Okay, arthrodesis, that's bone grafting. Arthroplasty, plasty is surgical repair. So arthro being joint, so surgical repair of a joint. Other things like discectomy, the removal of a vertebral disc. Okay, so you got a whole bunch of things going on here. Okay, and that's it. So I kind of flew through that one, but again, I want to keep these fairly short so that they hold your interest. It's up to you to read your chapters and get a little bit deeper into this. So I look forward to seeing you for Chapter 4.